Well, welcome. I am very excited today. We have some guests with us today for our expert panel, and it's going to be about understanding your medical bill and preventing medical debt. We have Dr. McManus and Colleen Rusnak with the Indiana Health Fund, and I'm going to make a wild guess that a lot of people that are going to watch this don't know who the Indiana Health Fund is, and that's why I'm really excited about getting you guys on here to talk about all that and obviously the topic that we're going to be covering today. So welcome to both of you, Doctor, and to Colleen. And who's going to get us started and kicked off here?
I think I'll go ahead and get started with a quick
Okay.
presentation.
If you need to share the screen, go down to the bottom. There's a little screen share. So
wonderful. Okay, I'm going to go ahead and share and get this going. Okay. And oops, can everyone see my screen okay?
right.
Okay, so I'm going to talk a little bit about Indiana Health Fund. We'll make it a little bit larger. So Indiana Health Fund was started by two physicians, Dr. Jeffrey and Dr. Lee Meltzer, and they started the organization because they found that there was a group of people that existed, that there was a gap in access to affordable health care. And they found that people in this gap, a lot of times had health insurance, but maybe they had health insurance with a high deductible. They might not be able to save enough financially to pay for their medical bills. And so that is why they started Indiana Health Fund. And we focus on assisting Indiana residents with financial resources to assist with medical bills, but also by providing educational resources to assist the community in learning more about managing medical debt, understanding your medical bill, how to prepare for medical expenses. And Dr. Kelly McManus, that is on the call today, she's actually one of the leaders and volunteers with our education platform committee. So she might be able to provide some more insight in some of those resources that we have to provide to the community. I mentioned we were founded by two physicians. They're both OBGYNs that really wanted to give back to the community. And they saw that, there is this gap that exists in access to affordable health care. And healthcare should, is a basic human right, and people deserve access to adequate, efficient health care, and it should be affordable. So they created an Indiana Health Fund to take on donations and use philanthropy to assist people in need with medical expenses, and to also educate the community on how to prevent medical expenses and manage medical debt. What has happened over the last 10 years, we've seen an increase in the cost of deductibles, and it has seemed to really impact families that are 2 to 4 times the federal poverty level. Those that are 200% of poverty level or below qualify for more government assistance. They might qualify for Medicaid and have other government assistance. They also tend to qualify for a lot of the financial assistance programs offered through hospitals. But what has happened, those are just outside that level, just above that 200%, now have high deductibles. They have increased costs in medical care and in larger medical bills. And it's really taken a hurt financially on people that are in this gap, as now they're deciding whether, to pay their medical bill, or are they going to buy groceries that week? Are they going to be able to put gas in their car? Can they pay their rent? So this is why Indiana Health Fund has started to really bring awareness to what is going on with the cost of healthcare and medical expenses. As I mentioned, the fund was created to take philanthropy and to assist people that fall in this gap, and to bring awareness that exists for families and individuals that are in this gap of access to affordable health care. We also have created our education platform, and on our website, indianahealthfund.org, we have several video tutorials discussing things related to medical debt. There's a video on surprise medical billing. There's videos on how to approach your employer to understand your benefits, your employee benefits and healthcare packages, and a lot more information, just understanding the basics of your medical bill and so forth. So the fund was created. We work with healthcare agencies. We work with foundations, corporations, and individual donors that have donated to us. We have a few grants that we've been awarded. We've been awarded a grant from Glick Philanthropies to specifically assist pregnant and nursing mothers, which is a group that is very in the hearts of the founders, as they both are OBGYNs, and they really want to assist and give back to pregnant and nursing mothers. There's also a lot of debt that can be related to to pregnancy and delivering a baby. And then we work directly with patient needs. So we have an individual application that individuals and families can apply directly to Indiana Health Fund to apply for medical debt relief. That can be also found on our website. It's indianahealthfund.org. And if you go to how it works section, a tab will drop down for our individual medical debt relief application. And then on our end, we work directly with our hospital partners to negotiate patients' debt. We typically negotiate the debt down to 40 or 50% of the bill. We wipe out the bill for that patient, and then they no longer have that bill. We take care of it, and then we help them with some different financial resources and financial counseling moving forward to assist individuals and families with preventing medical debt. We do this within the first year of when the patient has the bill. So within that first year, if you do not pay on your bill at all, it'll go into collections. And we want to make sure that families and individuals and families and Hoosier residents do not have their medical bills sit into collections, because then it affects their credit score, and that could do more long-term damage to those that have those bills. Again, the people that we assist, and I mentioned our fund specifically for pregnant nursing mothers, but we do assist anyone that has a medical bill that is 2 to 4 times the federal poverty level. They might have insurance through the exchange or a high deductible plan, which also puts a lot more strain financially on paying their medical bills. Other qualifying factors, again, it's between that 2 to 4 times the federal poverty level, but those that have financial hardship or they owe debt that's more than 5% of their annual income. So we really look at those that are facing financial crisis, or they might be facing medical bankruptcy. The fund was started, it launched in March of 2020, right as the COVID-19 pandemic hit. That's where we really saw a need for those that needed assistance. One of the first individuals that we did assist had a job and then lost it during the COVID-19 pandemic and had to have emergency surgery. And that individual still had health insurance, but since they had lost their job and he was a father of 2, that put a great financial strain on paying his medical bill. So we went in and assisted that patient, wiped out that emergency surgery. Also, he had made several ER visits, and that was due to the fact that the COVID-19 pandemic made it really impossible to go to his primary care physician. And then things built up and then had to have emergency surgery. And that's also a lot of what we see. We see that people are, they're not going to the doctor, they're not making the visits, and they're not doing those primary care visits, and they're afraid of cost. And that's really putting, a lot more strain on them in their health, and then causing a lot larger bills later on. I think on average, 1 out of 2 people does not regularly go to the doctor in fear of the bill. We're talking about 50% of the population that won't even go because of the fear of the bill that's in the cost associated with healthcare. I did want to mention our board of directors. I mentioned Drs. Jeffrey and Dr. Lee Meltzer, that are the founders and on the board. As well, we have several additional members. We try to connect across the state of Indiana, as we are looking to help those all across the state. So not just central Indiana, but we have board members from Terre Haute and Columbus. We have assisted individuals up in the northern region of the state, and we're trying to reach all different parts of the state. We have an additional board member that just joined, Dr. Cammie Wright, and she is Vice President and Chief Medical Officer with CareSource and has been an excellent value to Indiana Health Fund. We're very excited to have her on board, and we'll have a lot more to come from her expertise and her value as being a board member. I mentioned our website, and it's indianahealthfund.org. If there are any questions, I can be reached directly through email. That's crusnak@indianahealthfund.org. Please follow us on Twitter and on LinkedIn. We also can be found at Indiana Health Fund on Instagram and Facebook. So we appreciate all followers. You can submit questions. We have a community corner section of our website in the tips and tools section where we have a physician that answers questions. It might be medical bill questions, some healthcare questions, and each week he tries to answer a new question from the community. His name is Dr. Howard Egan, and that is something that I would also check out as you navigate the healthcare system, prepare for medical bills, or he also does provide weekly updates on general healthcare information. He provided a blog on influenza and preparing for flu season just recently, and we'll share several other articles that can be helpful. Okay, and that is the end of my presentation. I know it's a little quick.
That was excellent. The couple of things I was going to ask real quick while I was watching this is 200 to 400% of poverty, or whatever the income you're talking about. What does that equate to? What kind of a range is that?
So that would be maybe a family of four that has an annual income of $50,000, right around there. That would be an average. If people have specific questions, if they visit and navigate to our section of the medical debt application, in the application there is a link to a chart that'll explain. People get more information about how they might qualify, or what percentage of the poverty level they are at, which I think would be helpful.
Well, because I would imagine a lot of people don't know where that line is. I know I don't, so that's why.
Right.
Another thing I was saying, I definitely can see this being a huge thing, because you're right about being afraid to go to the doctor sometimes because of the bills. Our own personal experience, we had our company I don't know, 4 or 5 years ago, went with the exchange program for our insurance for all of our employees type thing. And my wife and I, with no kids in the house and healthy, we were at $1,700 a month and a $10,000 deductible. That was that was a lot of fun. Yeah.
Yeah.
So I can see how that happens. And then it wasn't, I don't know, a year or so ago. It turns out it was a panic attack or whatever, but I went in and just went to the heart place, and just for that ER visit was right at $6,000. It was like, holy crap, so,
right.
Yeah.
And you have a $10,000 deductible, so it's
well, this particular one was only $5,000 deductible, but still,
oh yeah, right.
But it was, but you're still going $5,000. Are you kidding me? So it turned out to be indigestion, but anyway.
Right. And that's what happens, and that's where we've done a little more. We're trying to do some more education about HSAs and how you can maximize, savings for healthcare expenses, especially if you have a high deductible plan. And a lot of times it's about picking the right plan for you. And that's hard. Everyone has those open enrollment periods, but you have all this information, and then things do change throughout the year. So, if you have some disease management you have to focus on, there's better plans. There's one plan that's going to be better than the other. And that's where I think some of the videos we did on our website in the tips and tools section focused on working with HR executives and understanding employee benefits packages too. That I think that really people need to understand, what questions to ask, how to review those packages, and pick the best plan for them. And we've worked with a few other people. We worked with Iconic Insurance, and they really assist people in helping find insurance plans that are the best for them, the best plan financially, and provides the best coverage of care too.
Now, do you work with people when it comes to the big people? I find that have the biggest challenge is finding, like, for self-employed or for independent contractors or what have you, finding, because most of those programs have not been particularly good usually, and they're very expensive. That's why, so.
Yeah. And that's where, we've been working with Iconic Insurance, and, we've done a little bit more with helping, buying insurance on the exchange. But that's where it does take a lot of research, and it is just, people that are self-employed, it's good to have programs like the exchange, but you're right, there's very high deductibles and and a large monthly cost too. So it
Yeah,
just makes
that
it.
well, we've been fortunate. I personally, I'm on Medicare now, so it makes it. So
Oh
now you
yeah.
have to figure out which one of those, right?
Right.
But my wife, I still have a real estate practice as well, and the company that we're affiliated with has a massive group policy that cut our costs in half, which was nice to see. So that, and it seems to be
Yeah.
pretty good, So, but anyway, but it's like trying to find those is
Right.
really difficult, So
It is very difficult. And even when you have insurance through your employer, it's picking the right plans. Some offer, you work with a larger employer, they're going to offer more plans, and understanding all of that, and it just depends like on how, what unexpected, you don't know what's going to happen too. So the best way you can plan for those, unplanned medical expenses and what
so do
comes
you
up.
guys help coach people on finding those things, or
No, we tend to focus, really on eliminating the medical debt and maybe preparing for medical bills. But as I've worked, with the community and met more connections, I have a list of people I can refer people to.
okay.
Yeah, and like I mentioned, Iconic Insurance, and there's a couple other individuals I've spoken with that are, looking that they can help people with that information. We do work closely with a medical billing advocate, Jenny Nolan of Clear Healthcare. She's Clear Healthcare Advocacy, and she's more on the medical billing side. But that's another partnership we have that I did want to mention, and she's provided a lot more, just kind of the basic information you need to know, like what is an explanation of benefits, how do you understand the terms of on your medical bill, and how do you understand, why is my insurance company sending me this explanation of benefits and what they paid and what am I responsible for and what questions do I need to ask, as things come up. So
Well, yeah, because and what I have found is every time they send a bill, it's different because
right.
it's like you never know when do I start really paying attention to it, so
Right. Yeah. And that's what's difficult, and I think it's confusing on purpose. I really do. I don't think, the system has not made it clear. And for medical expenses, there's no set price, right? And I know Jenny in her resources compared it to like buying a car. And that's why you see these different bills come in and you see these different costs for procedures. Another website that can be helpful, it's still a little bit tricky, is the Center for Medicaid and Medicare Services. It's cms.gov. If you know the code for your procedure you had, you can go on and see what the cost is, that what Medicaid would pay for that procedure and what the general just flat out rate for the procedure is. I think that's helpful for some people when they're trying to figure out, oh, maybe I had a small procedure done or a biopsy. Why is it, why am I owing $4,000 for this, procedure that maybe just seemed like preventative, or, it was only took a few minutes, and not fully understanding. And that's a good way to find out some more about the true cost. And when you're working with hospital financial systems, you can bring that up and say, if you can figure out I'm just over the poverty level or I'm close and Medicaid will cover this percentage of that procedure, can you match that price? And I think people don't know that, you can do a lot of negotiation with the hospitals. It takes time. You got to, find out, it takes time to get the right person. It could take time, connecting and getting all information together, and it takes some time researching. But I do think that people should be more aware, not only understanding that hospitals have financial assistance programs, but that you should be ready to, see if they will negotiate, advocate. A lot of times, sometimes they'll even be offering like a discount or a promotion, and they'll say, Eskenazi Health was offering a 30% promotion these last few months, and people don't 30% off the bill, and people don't always know that, right? So you got to research and do that. And then it's also
that's
hard.
something that actually happened. They're doing a 30% off.
Yes. Yeah. So that's something that happened. And I'm not sure who all qualifies for that. That's, you actually have to call and find out. And and what's hard is when people are sick and they're trying to pay their bill, that's a lot of time and effort to get all that done, right? So
Right.
yeah. And that's somewhere we can help with that too. If people are having questions or they're sick and they can't figure out who to contact, that's somewhere, if they talk to me, I can refer them.
Well, very interesting. So when people get a hold of you, I mean, what's first of all, I'm hoping people are starting to find out about you, that you exist. Okay.
Yeah.
And I would imagine that there's still more that don't know than do know, as far as that goes. But what's the process like? How do you help walk them through this process?
So like I mentioned, we're fairly new. We just became an organization in 2020, and then I came on board as the first full-time employee in 2021. And I'm the only employee. So typically what happens is, and I should mention, we just opened our individual application for medical debt relief in August. So prior to me joining, we had helped 4 individuals and families. In these last 2 months, we are now going to help 5, and I think we've got one more, so we'll have 6 total debt relief grants and packages done and completed. So we're really new, and we're just trying to do as best we can. But if someone has a question, I think if they could visit our website first, indianhealthfund.org, and review our resources, they can call us or they could send me an email. We also have like a general info line where we can answer questions. And typically, I'm usually the one that answers some of those questions. Dr. Meltzer might too. It just depends who's reviewing it. And we just work with them and get them on the right path. So sometimes people will call and, we are really we've helped people with bills that are from like 8 to 12,000 seems to be the range that we're working with. So, it depends on how large the bill is. I may have to refer them again to someone like Jenny Nolan or another medical billing advocate, or maybe they don't qualify. So we walk them through the process of how to talk to the hospital, how to set up, if they have questions about payment plans, things like that. And just kind of help them as best we can if we can't directly assist them. Since we have launched that individual application for medical debt, I recommend you can apply up to once a year. So we try to help as many people as possible. So if they read all the requirements and they qualify, you can apply once a year. And I would pick the largest bill they have and submit that bill for us to work on, if that makes sense.
Yeah. So, and this has to be done in the first year.
Otherwise, it's sent to collections. Once it's sent to collections, we can't assist them. Our partnerships don't exist with collection agencies. Our partnerships exist with the hospitals.
Okay.
So yeah, that's why we couldn't assist that.
So in other words, don't just keep putting it off, hoping that it'll go away.
Right. And I think sometimes people are nervous. There might be some fear of having debt or bills, but they could talk to us. That's why it's good to look at our references, our resources on our website first. Please reach out to us. I mean, we want to assist in any way we can, even if we can't help them financially. We have other resources to assist them. So.
Well, you guys were talking about understanding your medical bill and preventing medical debt. So I'm turning this over to let you guys head where you want to head with that. So yeah.
Sure. And I don't know. So Dr. McManus, I don't know if you have anything you want to add or start with. Because I know I've been doing a lot of talking, but if not, I can continue.
No, you're fine. The only thing I wanted to add was that oftentimes people are reluctant to ask for help for themselves. So you can nominate family or friends. You can do your best and reach out to Colleen on the website and kind of initiate that application for someone else. So if you know of a family that's been through a tragedy or had unexpected medical bills and are suffering, and you believe they meet criteria, you can reach out to the Indiana Health Fund and get the ball rolling.
Excellent. Yeah, that's good news.
That's a really good point. And I should mention, I could help them with an application. If someone's having trouble with the application or anything like that, talk to me directly. And we are updating our application to be in 2 different languages too. We're trying to add so we can help as many people as possible. So right now I'm working with we have a partnership with the Fairbanks School of Public Health, and we're working on a grant together. So they're helping us translate our application to help people that don't have English as their first language, so that hopefully we can help as many people as possible.
Very good. So I will say this: billing I have found to be extraordinarily confusing. Okay, and again, it seems like you get this bill, and then a week later they come back, well, you really don't owe this because the insurance is kicked in, but you owe this, and you're like, I don't have any idea what I owe, and so sometimes you're almost getting the late bill calls because you're still trying
Right.
to sort out where it is.
Right. And that's a really good point. And one thing I would recommend, and I know I mentioned Jenny Nolan's organization before, but the Clearview, it's Clearview Healthcare Advocacy, and she has just a small guide, and it's under her resource section on her website. And this guide will just walk you through, like you mentioned, you've got an explanation of benefits, you've got a bill, you don't know what you're responsible for, but it walks through each of the terms and sections and what you need to know about your medical bill and what you're responsible for and what you need to know from the explanation of benefits and how you should compare the two and walk through it that way. I think if any time, it's kind of hard because sometimes they'll send you a bill and then like a month later they'll be like, it's due now, as much as you can to be proactive, I'm working with whoever the bill's coming from, is really, the best you could do. But you do legally, have a year before they send it to collections. It used to be 6 months and they changed it. I think it was last February, or March, to a year. So.
Well, that's helpful. No, but like I said, I personally have dealt with that for family members and myself, and it's like, oh my God, I thought I had it all paid off, and then all of a sudden this other doctor shows up that I forgot about, that I didn't know about, that he was there or whatever. Or she was.
Right. And it is confusing because, you have the different procedures on there, and you're not sure, did I have that done, and that's right. The CMS.gov. At least you can try to get more information about what procedure you had and the actual cost of the procedure.
So going to prevent medical debt, before we have to get a hold of you, how does someone go about trying to keep it off their, how do we keep from having to call you?
And what has happened over the last 10 years, we've seen the rise in the cost of deductibles. And then now we've seen a rise in a lot of employers offering, or insurance on the exchange, a high deductible plan. So it's really looking at maximizing an HSA and learning more about, that's, some employers will offer a match to the HSA. But also what happens with the high deductible plan is I think you see people, maybe a little more hesitant to go into those primary care visits, or hesitant to like incurring those costs of medical expenses. And that's really been a shift in the healthcare system over the last 10 years. That's been a huge shift. You think about healthcare along, 60 years ago or even more, you had physicians making like even house calls and things like that. And you had your family doctor, and that's where you went to for everything. That's all changing. That's all different with the type of insurance plans that are offered. So I really do think, maximizing an HSA, and the more you could do that, and plan that way for medical expenses is one of the best routes to take. And working with insurance companies, and you can't always, sometimes you have insurance through your employer, or like I mentioned, Iconic Insurance, but that's, an insurance company that can, they will really work with you to find the correct plan. If you have diabetes and you have a lot of diabetes management, what's a good insurance plan for that type of care?
Well, okay, another one that's a big surprise that pops up is ambulance rides. Those can get really expensive. Is that stuff that's within your purview as well, or?
And that's something that you have to take in consideration, and that's, you can't always help that, right? You don't know. And that's not, as much preventative care you can do is, the best to help prevent situations like that. But, that's where the saving in the HSA and maximizing, those kinds of contributions can help, in setting up additional savings for medical expenses. And it's hard to do, right? And it's not everyone has the extra income to continually save for those type of expenses. And especially the people we assist, they are looking at, it's between paying their medical bill or their food or their rent, and that sort of thing. So that's the best, obviously saving's the best way to approach it. The second thing I really try to stress is, when you get those bills, is start talking to the hospital right away, right? We work with Community and IU Health and Eskenazi. We try to work with the largest hospital systems in Indiana. They all have financial assistance programs. They all have different, requirements. They tend to be the same. But that's who you want to start talking to right away with about your bill. Find out as much as you can. Like I said, it could be difficult sometimes to navigate those systems. It can be difficult to really, try to understand what are you asking for? How do you talk to the people on the phone about it? But that's probably the first step I tell people to start with.
Well, I go back to the ambulance. It was a wake up call to us. I remember one time, my wife was like, "I need to go to the." She knew she needed to go to the ER, so we were taking off. We live on County Line Road, basically. So we just got moving, and all of a sudden she was having some issues that we had to pull off in a parking lot to deal with. And I'm like, we're not going to make it. So we called the ambulance. Well, we were on the north side of the county line. We were wanting to go to a hospital. Our hospital that we never go to is in that county, so just further north. But then that hospital redirected us back to a hospital in Marion County because of the particular specialty. So they moved back there, and then we got like a $2,000 bill for being the wrong county.
Wrong county. And that happens. And that happens a lot. Right. And that's like, and who would know that unless it happened to you?
I'm talking, and basically we were in that county, and we were going to go in that county, and then they directed us to a different county, to the one we live in, so
and that's what happens. And I don't know that you have a lot of control in those situations to be like, oh, I really need to go to this hospital. It really is up to where you are and how they send the ambulance. So, but yeah, people don't know that there could be between Hamilton or Marion or another county, there could be a huge difference in the charge. You're exactly right. Yeah. I'm honestly, I don't know, again, the best way to handle that situation other than right when you get the bill. I would discuss that. I would bring that situation up and try to negotiate and talk about what happened, and I think people, again, and that's not always natural for everyone to approach situations with, and it's not always the easiest, but if you can advocate for yourself a little more in those areas, that you'd be surprised what, even just asking. A lot of times when I just ask, hospitals will start with a 10% discount.
Well, so, we were able to negotiate it down significantly, but I said, that it was like, oh my God, what is that? So.
And I've heard that several times from different people, about specifically, about ambulances. Yeah, it's kind of like something you wouldn't even think about. It wouldn't be. And then to even think about, what county am I in? When you're having an emergency situation, that's not really what's going through your head.
I'm a quarter mile from that county.
Right.
So it's like, to me, my life is pretty much in that county. But anyway.
Right.
So. Well, like I said, what Dr. McManus, you're being very patient there. Do you have other things you would like to bring into this?
One of the reasons that I joined the Indiana Health Fund is that I've, not only been am a physician, but I've been a patient myself, and it's been very eye-opening to navigate the world of insurance bills and understanding how to ask questions and who to ask those questions to. And so I found this really just a fantastic way for me to share my own journey as well. So in the experience with the ambulance that you just shared, I would say to you that is something that if you appeal to your insurance, that charge could be removed in appeals. And so that's where they would have a physician who serves on their medical appeals board, who goes through the actual bill, and then they go through the chart and they make sense of why this charge doesn't make sense. And then they can reverse the charge or greatly reduce it and really try and be a voice of reason on the patient's behalf. And so those types of things do exist, but it takes many phone calls or knowing that exists to know that you just have to push to get it. And I'm not one that advocates for being aggressive on the phone with people or rude, or, that kind of classic example of, I don't want to talk to you, I want to talk to your manager. There's so much that can be gained by just the first person you talk to. But what I like about the Indiana Health Fund and the resources that we have compiled is we're able to know when to direct you and how to direct you and who to talk to. So you don't have to assume that you're one, stuck, or two, that you have to be extremely assertive to get this solved. You just have to be kind and smart. So that's what we're here for.
So you guys do coach that kind of area as well, more or less, with people to help them. Maybe it's not in your purview to fix, but you go, hey, this is how you might want to address it. Because I don't think a lot of people know that these things are out there. I mean, a lot of people don't know that you can negotiate these things. They don't know, they live in a world where, this is the price, this is what you have to do, that type of thing, and you don't question that, so.
Right, as Colleen mentioned earlier, it's something that is, as a physician and as a patient, I consider a flaw in our medical system, that things aren't standardized, and that as the patient, we're really at the whimsy of the healthcare system we're in. And so one of the things that as a member and as a person who serves on the educational platform committee for the Indiana Health Fund, what my job is to do is to help educate people on the basics of how to know about your healthcare plan. So when you're scheduling a procedure or you're going for an x-ray that's not an emergency, make sure you're going to a place that's approved or in network, not just the one that's closest to you. So there are ways to be savvy to reduce those bills that you have the power to understand, and you have the power, and really you should be understanding that it's your job to learn and to know. As a physician, oftentimes people will say to me, if I'm going to order a lab test or whatever, well, where do you want me to go? Well, I don't have the answer. The answer is where's approved for your insurance company, and that's going to take a phone call on your part. And that's not something that people will say, well, my doctor just told me to go here. Well, that may be a place that their office has a relationship with to get the labs from, but it's not necessarily where your insurance company has a relationship with. So knowing and understanding these things is our responsibility as patients. And we can do better for ourselves just by learning and understanding things. And as an employee, I would say, when they have that open enrollment time, if you work for a company where you have open enrollment, asking those questions, going to your HR executive and asking, like, this is my provider, which of these plans will my provider be covered in? And knowing and picking your plans accordingly. Gone are the days that we used to just say, thanks for the healthcare benefits because everybody's covered all the same. That's just not the way it is.
Yeah.
Not, yeah.
There are some interesting models out there that are popping up that I like looking at. There's someone I know in Carmel who's a nurse practitioner that's got a GP office pretty much, and it's she charges like $75 a month, and you basically have all the medical you want, during which I think is very clever. It's I like seeing things challenging the market. I guess that's a good way to put it. You guys are doing some amazing things. I love it when I see people that are, okay, we have a problem, how are we going to fix it? They're trying their models to do that. So there's there's one in here that works only with Medicare, but I love what they're doing. They got different things, and they change the whole model of doctoring in that case. So I love seeing that. That's one reason that's one reason Life Scope, I was trying to bring these things to the forefront and getting this information out. We, like, this video will go out across a lot of different platforms. It'll be on our Facebook page, it'll be on our website, it'll go out to 10,000 emails on our newsletter. So that's the whole idea, is to try to get this information to people so they can, so they're not walking around in the dark.
Yeah, and we really appreciate that. That's wonderful, because again, one of the largest challenges we have had is bringing awareness of who we are and what we do. So yeah, we're trying to continue as much as possible to bring that awareness. And I will say, a lot of times I'm working with someone that's a caregiver for a patient, and a lot of times it's just helping that person navigate for the person that they're giving care for, or they might have power of attorney working with that patient, so I can help them with resources too. And they might even do the application for the patient. So that happens a lot too, if that's a situation. I think some of the people that are on your email and your listserv, I think a lot of them are caregivers as well. So
Exactly, and then we target more towards a senior situation, but I would say for a child advocacy as well. You have, but and this is something that I can speak from a personal experience of dealing with it with family members, is you need an advocate that's there with you, not only just from the billing side, but for the actual care side, because it's amazing to me how they don't get, it's like the communication between one department and another department and one, is so bad, so many times. It's like you feel like you're telling your story every 15 minutes if you're in the hospital type thing, so
Right, true. Yeah. And that can be challenging. And again, if you're sick, that's tiring, and it's, it just puts a lot more on your plate. So yeah, hopefully we can help map things out for people, get them connected, help them ask the right questions too. So we have more wonderful volunteers like Dr. McManus. We have quite a few more volunteers and we have a large board of directors. So we have a lot of connections and resources too to help people.
Well, I'm very excited to having you guys on here. I'm not going to try to make you stay longer than you need to, but it's like, it's like, 'cause I know that you guys have other things to do as well, but I really appreciate your time on here. And like I said, I'm looking forward to getting this information out to people as well. And, I do anything you want to make sure you get on this call before we get out of here.
Definitely people should check out our website, indianahealthfund.org. And if you scroll down the first page, you can sign up for our email list and our listserv. Please sign up. You'll get a monthly email, all the different resources we put out through education platform, as well as who we're assisting, or if we have special funding available for certain different patients, and all of that information. So please check that out. I would appreciate it.
One question, I understand that, we've been talking for the people that need your services to help them with their bill, but my guess is that you also do fundraisers and do you have needs for donors as well, that if there's somebody watching this going, well, I really love this, I'd like to help out.
Yeah, that's a really good point. And we love our donor support. Anyone that has an interest in our cause and is interested in our mission and wants to assist the community that we do, they can connect directly with me or Dr. Jeffrey Meltzer. They can find our information on our website. We actually just met our goal for our Helping Hands campaign. So we're very excited about that, raised just over $100,000, which has gone to help a lot more people. But yes, we have that funding need so we can assist as many families and individuals as possible. But please connect with me if anyone has an interest. I'd love to share more information, tell our story, and give more information to those that support us, as we really appreciate that.
And I just heard you mention that Dr. McManus was a volunteer. What does that mean? What do you guys do as far as volunteers, and who are you looking for to volunteer?
Oh yeah, go ahead, Dr. McManus, if you want to talk a little bit about your role, and I could.
Sure. There's several of us who are professionals and have worked somehow affiliated with healthcare, whether it be through business as physicians or as just healthcare advocates. And we volunteer our time and we have our own meetings, and we decide what we need to do to help get the word out or how to best serve the organization. And yeah, we don't have any large scale events where we would be looking for just one-time volunteers at this point. That's a goal of ours, to be able to host an event of some sort. That would be an outreach. But at this time, to be a volunteer would more be something that would be a couple years of commitment and really an investment in the organization. And we're a new organization. So as time goes on, I'm sure there will be more opportunity for volunteerism within what we do.
Well, I can see some of the people in our group, our sphere that might watch this, that might be very interested in that type of a commitment. So that's why I just wanted to make sure I found out what that was. So yeah.
Yeah, and I appreciate that. Anyone that has an interest in volunteering, if they come to me, I could direct them. and set them up if they have an interest in education platform, or again, helping us bring awareness, whatever that might be. We do have a few interns that help us with social media. We have one coming on to help us with social media, and we've had some people help us with the education platform. So yeah, anyone that has an interest can let us know. We appreciate it.
Excellent. Well, I will also attach, I'll attach your name, your name and contact information, and I'll put your website on this, when it goes out, so people will have access to find it as well. So
Yeah, that'd be wonderful. Thank you.
Thank
thank you
you.
guys. Thank you so much for being here and sharing your time with us.
You're welcome.
Thank you so much.
All righty. Take care. Bye-bye now.
Bye.